Hello, good morning, good afternoon, good evening, and welcome to Zoom. There it is, designing and delivering a stay-at-home friendly HIV prevention trainers workshop. My name is Aubrey, and I'm joined today by my colleagues Patricia, Def, Casey, and Millicent. We're thrilled to share some of the work we've been engaged in over the past year, including key lessons learned and ways we've succeeded in adapting to the ever-changing environment of global health and development. In 2020, the global COVID-19 pandemic demanded a shift in how we think about and deliver technical assistance, including capacity strengthening interventions. More specifically, our choice team found ourselves asking this question: how might we continue to support the scale-up of the Options HIV Prevention Ambassador approach across countries and strengthen implementing partners' capacity to use the training package in an online environment? Or to put it simply, how might we best react, adapt, and respond to the rapidly changing landscape of global health and development? How about to a new normal that is neither new nor normal? Our team, made up of staff from FHI 360, LVCT Health in Kenya, and PZAT in Zimbabwe, capitalized on this unique challenge and opportunity to innovate by designing and developing a comprehensive, interactive, and entirely virtual version of the HIV Prevention Ambassador Trainers curriculum, which allowed for leaders and trainers to learn and collaborate together across geographies. Through this iterative process, the HIV Prevention Ambassador Trainers Workshop, How to Engage Adolescent Girls and Young Women as Advocates in Their Communities, was born to continue to meet the training needs of mentors, while opportunities for face-to-face learning were either limited or impossible. Now I'll pass it over to Patricia, who will dive a bit deeper into our process.
Thank you, Aubrey. The HIV Prevention Ambassador Trainers Workshop is comprehensive in that it covers a wide range of topics that are crucial for trainers of ambassadors to master. It is also highly interactive. In the age of webinar overload, we made and continue to make conscious efforts to ensure that this is not just another webinar, but more on that later. The main goal of the trainers workshop is to prepare HIV prevention ambassadors trainers to present information effectively, respond to participant questions and concerns, and lead activities that build HIV prevention ambassadors' skills and knowledge in providing their peers with accurate information about PrEP. At its core, our workshop offers programs, an online approach to achieving pre-exposure prophylaxis, that is PrEP, targets, and supporting adolescent girls and young women to reduce their risk of HIV infection. It is designed for those who will train adolescent girls and young women to become HIV prevention ambassadors in their communities and is conducted online via Zoom over the course of 5 days. Each day consists of 2 key components: a 2.5-hour live Zoom session including games, quizzes, case studies, small group work with personal mentors, and other interactive elements, and assigned homework and group work to be completed during offline hours. Sessions include training preparation and facilitation, oral PrEP essential knowledge, peer support, boundary setting and self-care, mentorship and understanding different learner styles, to name a few. Now I will pass it over to Def to talk about the experience of training in a virtual space.
Thank you so much, Patricia. So there are a number of pros and challenges to training in a virtual world. Through the process of creating and iterating our curriculum, these in particular stood out to us, though this list is not exhaustive. We refer to the second column as challenges rather than cons. These items, while more difficult in a virtual environment, are not entirely unachievable or inconceivable. The key is to keep an open mind to what is possible with the technology at our fingertips and be willing to fail forward. We agree that face-to-face interaction and learning cannot be replaced one-on-one. But the truth is, so much and likely should be done virtually, especially as we look to the future of global health and embrace practices that are more accessible and equitable for all. So in my experience, virtual trainings can be a good way to continue learning while we live and work in this new normal. However, we learned that we must consider the checks and balances in place to guarantee we achieve what we set out to do, real, sustainable learning and skills building. In the absence of adequate checks, virtual trainings can result in less engaged participants using time to multitask and missing the objective. From the trainer's perspective, this is especially important to be mindful of. Now I'll pass it over to Casey and Millicent to talk us through the efforts we've made to make our training unique and not just another webinar.
Thank you, Def. So as we all know, everybody is sick of webinars. These long calls, you spend them half paying attention, half multitasking, and it's just not working. And we knew that. But we also knew that there was a demand for this training, and it was our duty and our job to make it as good and as compelling as possible. So how did we do that? Well, I will let my colleague Millicent talk more about that.
Thank you, Casey. So we knew we had to create a process for learners to connect with the training content in a meaningful way. Luckily, we had a group of talented and dedicated facilitators as part of our crew. So every day was structured to include ample small group time with mentorship teams that had a facilitator who was also a subject expert. So during the small group sessions, 8 to 10 learners would get to know one another, have some face time with their designated mentor. Groups reviewed the day's content and worked through tricky situations. And this helped to keep the learners accountable, encouraged peer learning, and provided space for less outspoken participants to feel comfortable to talk and to ask questions. Mentors and mentees shared contact information to be able to keep in touch after the training had ended. A post-training survey showed that 78% of respondents agreed that the mentorship teams facilitated their learning. I'm going to hand back to Casey to tell us a little bit more.
Thanks, Millicent. So as you can see, we did get some really positive feedback from the participants in our sessions. Shout out to Rockstar mentor Millicent. While our hope is to continue this relationship building that we started during the training, the pandemic has definitely shifted priorities for all of us, and it's frankly stalled our plans to extend rather than mentorship model beyond the life of the training. But with continued interest and positive feedback, we do plan to re-engage all the training participants from each iteration in future office hours. These are sessions that take place via Zoom, and they're drop-in, informal meetings where participants can have the opportunity to ask trainers and experts questions that have come up as they've been implementing what they learned in their communities. Back to you, Aubrey.
Thank you, Casey. So in closing, the pandemic propelled us to use the technology at our disposal to train trainers to deliver health information to young people. The HIV Prevention Ambassador Trainers Workshop prepares those trainers to present information effectively, respond to questions and concerns, and lead activities that strengthen skills to provide ambassadors' peers with accurate information about oral PrEP. This intervention is important to the intersecting fields of youth, technology, and health, and that it could lead to greater access to and use of HIV prevention options for and by adolescent girls and young women and their communities. Thank you all for listening today, and to ETR and YTH Live especially for having us here. It's such a wonderful conference, and we're privileged to share our work. Please find all of us on Twitter. We'd love to continue learning with all of you beyond today. So thank you very much.